Thank you for your kind introduction. So first I will be talking briefly. I'll be just touching surface of everything. Then I would really like to have a more interactive session rather than a one-sided lengthy talk. Because if you see, the studies also say that a human mind can actually focus not more than 20 minutes at a stretch. So I'll try to confine my topic. So this thing. Are my slides visible?
Yeah.
Yes, doctor.
Yeah. So I'll just talk. So right. So if we have to say what is a cancer, so cancer is just an unregulated division of cells. Most of the times what happens in a normal body is cells die and they are again replaced by new cells. But if there is unregulated cell growth, it leads to cancer. So there are different types of cancer. If you have to classify, there are more than 100 types of cancers. So basically, how do we classify? By the kind of cell it originates from, and also from the tissue, from the organ it has arisen. So if it is from the skin or epithelial, the covering surfaces of all the bodies, we call it as carcinomas. If it is from any muscle or bone, we call it sarcomas. If it is from blood, you call it as leukemias or lymphomas. So if there are any tissues which connect two different types of cells, then they are also called mesenchymal tumors. So now, based on the body organ they originate, we can classify them based on the origin of the tumor. Like if it starts from breast, you call it breast cancer. If it's from liver, you call it liver cancer, and you call it kidney, you can call it a kidney cancer. So what happens often is it starts in one organ of the body and it spreads. So the most common sites any cancer can spread is lungs, brain, liver, and bones. We don't know why. Probably because these organs have received a lot of blood supply. So if we have to say, there is a multifactorial reason why cancer happens. So some few percentage of them can be hereditary and non-hereditary as well. So majority are non-hereditary, what we call it as sporadic cancer. And among hereditary, it is because of probably certain genes which makes a person more susceptible to certain kinds of cancers. And we can have that information by looking at the family tree and see how many in each generation, how many individuals were affected and by what kind of cancer. And not all kinds of cancers are hereditary. There are only certain specific type of cancers which are hereditary, like breast, ovary, colon. Lung, on the contrary, lung, head and neck cancers and blood cancers, they are sporadic rather than being inherited or a familial cancers. Now, if we have to look at the prevalence, the most common is the breast, followed by colorectum, and then prostate and lung. So this is the worldwide data. But if you come down to our country specifically, in women, it is again breast, ovary, colon, lung. And in men, it is most commonly the smoking related cancers, which is head and neck cancers, lung cancers, colorectal, prostate. Now, what causes cancer? We don't have a specific cause, like we don't have a causality saying that this will cause cancer, except for very few cancers, like certain viruses, like HPV virus is known to cause cervical cancer vaccine, certain types of head and neck cancers, HPV associated oropharyngeal cancers. So certain viruses can cause. Most of the time when we are exposed to certain kind of chemicals or environment or radiation, it predisposes us to develop cancer. So it's like, just to say, if out of 100 people who smoke, some 30-40 would develop some cancer at some point of time, as compared to non-smokers, probably 10 would develop cancer. So we know that these agents, be it the chemical or the physical agents, will make the person more prone to develop a specific type of cancer. So what we call them is risk factors, rather than telling that they are the causes of cancer. So if you are exposed to these kind of thing, there is a chances like they will develop cancer. To put it in a simple language, so if you are not wearing a helmet, you are likely to have an head injury in case of an accident. So that's how it is. So these risk factors, and of late we have understood well that cancer is more of a lifestyle disease. And those lifestyle could be your food, your lifestyle, and the way you work out. So smoking, obesity, sedentary lifestyle, alcohol, red meat, processed food, all these can cause increased risk of cancer, just like heart disease and stroke. Now, the thing is, we are able to control heart disease and strokes because we are getting more and more aware of it and getting more checkups for it, and we know how to prevent them. But however, cancer is one which is probably overtaking them because we are not actually concentrating on more what causes it. Now, how do we test? How do we detect cancer? So cancer can be detected by two things. One thing is it's either you screen so that you can detect the cancer at a very early stage, or you do certain tests where you know that there is increased predisposition to cancer. So most importantly, it is the medical history and of the patient and the family, and any early signs like any swelling or any bleeding, any weight loss, loss of appetite. All these could be any fever which is not subsiding with any antibiotics, any number of antibiotics, and one has already looked out for all the infectious causes. All these can do. Now, the other way to detect is the upcoming things is, do we have any biomarkers? Conventionally, we only had tumor markers, which are simple blood tests to identify certain type of cancers. But now we know that they are not so accurate. And most of the times when these tumor markers are elevated, it's quite advanced. So we now have genomics, proteomics, and metabolomics to identify whether whether someone has a cancer or not at a very early stage. But to commit we still don't have a population based test to do a mass screening and detect who has the cancer. And also it depends upon the pre-test probability, which means that what is the risk of cancer in that population. So we can actively screen for cancers in smokers by looking at oral cavity examination or a low dose CT. Whereas it comes to women, it's a yearly mammogram after the age of 40 or 50 years. So these are the certain things which we can detect the cancer early, and early detection leads to increased survival and cure. So among the imaging modalities which we can use to detect cancer, X-ray, again, it's easy to do, but most of the time, by the time we find things in X-ray, it's often late. So the best way is whenever someone suspects is either to do a CT or an MRI, depending upon which organ it is involved. Ultrasound and X-ray are simple basic screening tools, and they're not so sensitive enough to pick up small tumors. Now, what we have is a PET scan, which is nothing but which combines a CT scan with a functional imaging, because tumors consume a lot of glucose. By doing a PET, we know that, if the consumption is high, probably this is where the tumor is, and we can localize it much better by using a PET. So it's again useful in certain types of cancer to see whether it has spread to other parts of the body. And not every patient needs a PET scan, but we often do a lot of PET scans for most of the cancers. Some cancers it is not even required. Now, coming to the most common cancer, and this being the breast cancer awareness month, breast cancer screening and detection. So there are three things which one can do. One is clinical breast examination and breast imaging. And on suspicion, one needs to do a biopsy, which is you're taking a piece of the tissue to confirm. So clinical breast examination is not so sensitive enough, but nonetheless, most of the women we suggest to do a self breast examination, and if they find any lump, to consult the doctor. Breast imaging, because sometimes tumor as small as 0.5 centimeters may not be detected by self-breast examination or by examination by a physician. We always suggest to do a mammogram, yearly mammogram. And in young patients and in patients who have hereditary breast cancers, we often advise to do an MRI at a very early age. So mammogram is nothing but a low dose X-rays which will visualize any small lumps in the breast, and its sensitivity is actually higher after the age of 40 years. So that is one thing. And when there is a suspicion based on the mammography findings, where you actually grade the possibility of having a tumor, we do a biopsy where we take out a piece and see whether it is really cancerous or it's a benign lesion, which is technically saying it's not cancerous. So biopsy is the gold standard, and without biopsy, it's not right to say that someone actually has a cancer. So treatment options for any cancer now are armamentarium to treat cancer is increasing on a very daily basis. So previously it was chemotherapy and radiation therapy and surgery. These three are the three important cogs of any cancer treatment. Sometimes we use all the three modalities, and sometimes we might use a single modality depending upon the stage and type of tumor we have. So chemotherapy is nothing but drugs, purified drugs, which are used to destroy selectively cancer cells. But obviously there are certain side effects to it, because some amount of normal tissue also gets destroyed. It's something like using a carpet bombing, where you are killing all the cells. Now we have targeted therapy. We have newer drugs, targeted therapy, which are very specific to the tumor. It's like more of image guided missiles, where you are specifically hitting a target by using those drugs. And now this decade has been a decade of immunotherapy, where we are using drugs which enable our body immune cells to attack the cancers. So cancer cells have very novel mechanism to escape our body immunity. See, they develop certain molecules to evade our immunity. So what we do is we trick that, or we block that system, and make our immune cells, which are already there in our body, to fight cancer, just like how we fight infections. Apart from that, we do have a lot of technological advancement in radiotherapy as well, and as well as in surgery, where now we are using minimal invasive surgeries, where we are not doing extensive surgeries and doing with minimally invasive laparoscopic and robotic surgeries, where the recovery is fast and the cosmetic outcomes are also very good. Now comes the most important part, the preventable, how to prevent. So most of the time, it's again lifestyle modification. Almost 1/3 of the cancers in our country are caused by tobacco, direct or indirect. So tobacco cessation is very, very important. Second is obesity or overweight. And again, it's as bad as a pandemic, because we are seeing, because of obesity, overweight, we are seeing patients having diabetes even at the age of 25, 30. So these patients are the ones who are likely to develop cancer at some later point of time, which is bad. And certain viruses, like especially hepatitis and HPV, these can predispose to cancer. HPV is associated with hepatocellular cancer, liver cancer. HPV is associated with cervical cancer and head and neck cancers. These can be prevented. We have good vaccines for it. And most importantly is the physical activity. What we say is sitting is the new smoking. So it's always important to move around after 30 minutes of sitting. And good dietary habits, which is avoid processed food, too much of sugary drinks, avoid red meat, and also good exposure to sunlight, and good a healthy lifestyle is minimum of 30 minutes of physical activity apart from your day-to-day routine work. So a lot of patients do ask, I always walk up and down in my office. I walk 6,000 steps. So the most important thing is, apart from your routine activity, you have to do 30 minutes of additional physical activity. And that physical activity can be as simple as plain walking. It's not like you have to hit the gym, you have to do a treadmill, you have to do a cardio, you have to build muscles. No, it's only 30 minutes of good physical activity, which is as simple as walking. So then the role of hereditary and breast cancers and the screening came with this famous, the Angelina effect. So her mother had breast cancer, and she was diagnosed to have a BRCA1 and BRCA1 gene, which is very important for hereditary cause for hereditary breast and ovarian cancer. So after her mother was detected to have BRCA1, she underwent a bilateral prophylactic mastectomy and removal of her ovaries. And with that, the risk of breast cancer is reduced by almost 95%, and by ovarian cancer by almost 50%, as well as the peritoneal cancer. So with this, the awareness about preventable causes of cancer deaths, the cancer screening for hereditary genes has started. And initially, these assays were very costly. They were almost costing for lakhs for each test. Now the cost has come down drastically. And previously, it was only for prevention, where we used to do it for a case who has a very strong family history. We used to do it for the index case and then advise all the siblings and the relatives of them to get it screened for. But now there is a therapeutic implication for it, because more and more we are seeing that if we screen these, if someone is positive for some of these familial cancer genes, there is the way we treat them is different. There are certain specific targeted drugs for these patients, which is likely to help which is likely to cure or at least control the disease for a longer period of time. So that was very important. And if we look, this BRCA1 and 2, they have a very high risk of malignancy. Almost 80% would develop breast cancer at some point of time in their lifetime. And almost 50% of them would develop ovarian cancer. And apart from that, the other cancers which can be there is prostate and pancreas, which is seen in a small subset of these patients. Now, the problem with genetic testing is whatever data you have is of the Western population. So in our country, we don't follow that stringent criteria to do a hereditary breast cancer, because we don't have that genetic data of our country, of our population. The reason being is our life expectancies have just improved in the last 20 years. Previously, people would die even before they could get a cancer. Now we are living long enough to get cancer. So we don't know whether we have that hereditary predisposition or not. So any patient less than 60 years of age, be it breast, ovary, prostate, or pancreas, we are doing BRCA1 and 2 testing. And it's like, to put it in a simple term, everyone has a different type of nose. So that is because of our genetic makeup. There are certain combination of genes because of which each of our nose is different. And we don't know which one of our nose is normal until and unless it's very grossly deviated and abnormal. For a gene as well. So we might have different genes, but we don't know which is the normal one or which is the abnormal one. So when we have a population data, we can see that this variant is a normal variant of in the population, or this one is a pathogenic. So that is the reason in our country we don't follow very stringent hereditary screening. So any patient less than 60 years of age, we do this BRCA1 and 2 testing for patients with breast, ovary, prostate, and pancreas cancer. The reason is we don't know who will be positive, and the percentage whatever we have is the Western data, and there is a significant therapeutic implication for it. So again, the benefits is early detection. We can put on a strong, by screening individuals, we can put them on a strong screening program. We can prevent by any preventive surgeries. And also, if one person is positive, we can also do a predictive testing for the other family members. So that's the advantage of doing a genetic testing. Thank you. I think now I'm open for all the questions.
Thank you, doctor. I think I'll just add the last thing where you can get these tests done here in the chat box. So you can get connected with 4Base Care. So they are specialized in cancer screening and early detection. So in case you have something on your some cancerous history on your family or any genetical cancers that can cause cancer, you can get it tested. So I think we can take up the question. And before that, I'm going to roll out a poll. People, please help me fill this. All right. So we already have some questions here. So doctor, will passive smokers also have chance to get affected with cancer? If yes,
Definitely.
at what percentage or anything like that?
So patients who are affected with secondhand smoke, they do have a slightly higher risk than the normal population. So they definitely have 5 to 10% additional risk of developing smoking related cancers, which is basically head and neck cancer or lung cancer or esophagus or the esophageal cancer, which is the cancer of the foot pipe. So that is the reason the regulations of no smoking areas and public smoking in public areas has been prohibited, because there is significant risk of second-hand smoke causing cancer and other health problems.
So I've heard this myth in the past that the second-hand smokers are more in risk than the person who's smoking. Is that right or not?
It's absolutely wrong. So if I have, if I have to grade the risk, active smokers, ex-smokers, second-hand smokers, no smokers or never smokers. That's the
all right. Yes. So which type of cancers doesn't require PET scan?
So generally, any localized, very early tumors of breast don't require a PET scan. Early tumors of ovary doesn't require head and neck cancers, early stage don't require. Most of the early cancers don't require a PET scan. It's only when there is a locally advanced tumor where the size is big, you want to know that whether it has spread to other areas of the body. That's when we do. And routinely, we also do it in lung cancer, because lung is such a big organ. So even until the tumor grows to a significant size, no one gets symptoms. So for a 2 centimeter tumor in lung, no one gets any cancer. So by the time it becomes from 2 centimeters to 3 centimeters, there's a very fair chance it can also spread to other parts of the body. So lung cancer is where we do PET scan even for an early stage, suspected early stage. Otherwise, most of the early stage don't require a PET. Lymphomas, all lymphomas require a PET. So that's how it is.
Okay, good. So as you mentioned, there is tumor and there is cancer. Is it like same or is it different? We have Madhvi who's asking, is brain tumor and brain cancer same? If yes, is it hereditary?
So cancers are a subset of tumors. So most of the time, both are used interchangeably. When we say a tumor, it's an unregulated cell growth. So again, there are two types of tumor: malignant tumors, benign tumors. The malignant tumors are called cancers. The benign tumors are not called cancers. They are just called a benign tumor.
It's
the
just
major
that it's
difference
fastly
between this
spreading.
is, yeah, exactly. So the benign one doesn't spread anywhere. It stays at the place of its origin. Whereas a cancer spreads very fast, can spread to other areas of. Brain is a very interesting organ where the brain cancer doesn't spread to liver or lungs or bone. Even if it is a brain tumor, it grows significantly in the brain, the patient dies. So they don't even reach that point. A 5 centimeter tumor in brain, the patient is already symptomatic, he goes for a surgery and everything. They're very difficult to treat tumors. But if it's a benign or a very small tumor in the brain, they do get cured.
Is it hereditary, the brain tumor or the brain cancer?
Not all. Less than 5% are hereditary. Majority of them are sporadic.
Okay. So is not using aluminum non-stick silicon utensil one of the way to prevent cancer?
I would suggest to use not to use any non-stick cookware. It's better to use your steel and this thing. What do we say? The age-old iron pans, those things. Non-stick and aluminum, obviously, they do have certain risk. But again, like these are all risk factors. We never say, but if you use this, you'll get cancer. It's only increasing your baseline risk. That's it.
Okay. All right. So, why is red meat one of the causes for cancer, and how much is it okay for consuming?
So what they say is red meat causes a lot of bowel inflammation. They are very rich in proteins, and those proteins need not be assimilated by your body, and they are very likely to cause a lot of irritation in the bowel and inflammatory kind of thing. And that's why they are more predisposed to have colon cancer. And how much, we don't know how much is safe. We don't know the safe limit. But generally we say once a month is fine.
Okay. Yeah. So I have opened another poll of what kind of session would you like to join in the future. You can just drop them that. Also, as mentioned earlier, for any kind of cancer related test, you can directly connect with 4B's Care. I have dropped the contact number and also the email ID. So you can just request or get to know, just have a call with them and understand the risk and also get your test done. Okay. What are the causes of leukemia?
So leukemia is basically a blood cancer. Like I said, there are no hereditary causes, not much of causative. What we have seen is sometimes increased use of pesticides can cause some kind of leukemias, but mostly we don't know the cause. And in general, as the age increases, so certain kind of leukemias become common, like acute myeloid leukemias. So as the age increases, it goes above 70 like that. They do get some kind of blood cancers. Age is a risk factor.
Okay. Is there any specific test which can be done yearly for screening, not age specific? Cancer screening.
So there are cancer screening for specific cancers. One is breast, one is colon, and one is lung. So, and cervical cancer. So in women, it is breast, cervical, colon, and these three are most. In men, it's mostly colon, and for smokers, it is a low-dose CT for lung. So for breast, it is generally yearly once mammogram after the age of 40. For a cervical cancer, it's a pap smear once in 3 years. And for a colon cancer, it's stool for occult blood once a year after the age of 45.
Okay. If we don't know which organ to test, is there a generic test that can detect any cancer that might be in the body?
I didn't get you.
So if you don't know which organ to test, is there any generic cancer test that you can do?
No. So the point is there are so many different types of cancers. We can't have a screening test for all of them. So it's still in a very preclinical developmental stage where people are looking at certain molecular tests where you try to identify the cancer before it is actually visible on the scans. So we are still not there yet, but I think the research is in that direction.
Okay. Why secondary smoking has higher risk for cancer? I think we just covered that. As mentioned by Vinaya, this is a myth that is propagated by smokers only. So Bipin is asking, does exposure to X-ray test and CT scan cause cancer risk?
So anyone, there is a lifetime radiation risk which can increase to the cancer. So what we say is we try to avoid as much as CT scans or this thing, but most of the CTs and PET, they do have a very low risk of cancer. So someone has to actually go through good number of CTs and X-rays in their whole lifetime to actually have cancer because of those investigations. So the recommendations also say that you shouldn't be getting a PET scan more than 4 times in a year, even if someone gets. But it's not routinely recommended. Even for cancer patients, we try to keep it less than 4 a year. until and unless it's absolutely necessary.
Got it. 400, this unprocessed meat, we have already covered that, I guess. Is nicotine patch a good alternative to smoking?
Definitely, it helps you to get rid of the addiction because of smoking, and one should always try to use it for de-addiction. It's a important tool for de-addiction.
Okay. So Prajakta is asking how the cancer treatment is getting easier compared to the traditional longer cycle radiation. Any news or safe new technologies that is coming up, that is in upcoming years?
Yeah. So basically, it's already there. I think if you look at the toxicity of treatment because of chemotherapy or radiotherapy over the years, we are getting better because of improved learning curves of the doctors. Second thing is, now we know we have good supportive care medications to prevent vomiting and all those things. Now we do have certain technology to prevent hair loss by using some cool caps during chemotherapy. Radiation, you have better techniques, better machines, where you are using a lot more 3D planning and image guidance, and where you are trying to adjust the radiation to the body normal respiratory movements and all those things. So with that, you are decreasing the risk of the side effects. That's how it is. And there is increasing evidence. Previously we didn't know how long. So we were now there are a lot of studies going on in certain studies in certain cancers where we can actually decrease the intensity of treatment. Now we are also doing a lot more molecular testing for the tumors to decide whether this molecular subtype of the same tumor, does they require chemotherapy or not? Like in breast cancer, hormone positive, early breast cancer, we are doing genetic testing, the molecular testing of the tumor to decide, probably these patients don't require any chemotherapy. So use of molecular tests, improving technology, better supportive care, definitely the toxicity associated with cancer treatment is decreasing.
All right. When we must schedule health checkup of full body, I mean yearly or twice a year?
Health checkups are generally overrated. Frankly, they don't even diagnose anything. Most importantly, if you're maintaining a good healthy lifestyle, except for the certain specific tests and certain specific tumors we need to check for after a certain age, there is no recommendation to say you do a CBP every year, you do a lipid profile every year. You can just have once and just see if you're if you're getting obese and everything, it's worthwhile looking at your sugars and lipid profile once a year. That's it.
Does regulator fasting have any positive effect on to prevent cancer?
What does have a preventive? Does regulated fasting?
Regulated fasting, yes.
Oh, okay. That's again very trying to solve a complex problem with a simple solution. No, it's no. So fasting doesn't help prevent cancer. If you do it in a decent way, probably one might lose weight with good dietary modifications, cutting down on carbs and sugars, good physical activity. And above all, I think so one should also get relieved of the stress. Stress induces a lot of obesity. That's what I feel.
If there is a family history of cancer, then what is the probability of cancer for the subsequent generation?
So if there is a family history of cancer, one should actually undergo a good genetic counseling and see what are the kinds of cancers affected that the family has. If the family has, say, one has a gastric cancer, two of them have a colon cancer, we are looking at a certain colorectal cancer hereditary syndrome. So we'll be checking for certain specific genes. So if there is a breast and ovarian risk in that family, along with the prostate and pancreas, then you will be looking at BRCA1 and 2. So if someone has, one should take a good family history. What is the kind of cancer and what is the age of onset? If someone has a breast cancer at the age of 80, it's probably age related. It's not hereditary. So at the age at which they got, in such patients should go genetic counseling. And there are a lot of hereditary genetic tests available at a reasonable price. One should get tested for them, and then we have to see. And mostly, if someone has a cancer, we have to check whether they are affected or not by testing that patient. Because what happens is we get 50% of our genes from our father, 50% of genes from our mother. So it's not like always we are affected by that gene. So if a person with cancer is checked for that, if that gene is affected or not, then we can test the siblings or the kids. That's more rational way of doing it.
Okay. Drinking water from copper vessel daily and all the time, how can it impact balance of copper in body, and can it lead to cancer?
It has nothing to do with cancer, first thing. And again, it's like an overrated concept of, drinking from copper will be healthy. So first thing is, we don't know what is healthy. Define healthy. Anything which you do within the limits of normal thing is healthy. So I think it's better not to drink from plastic. I can say the other way around, avoid using plastic glasses or plastic bottles. Try to use any kind of metal, this thing. That would be better. Copper, it's not like it will provide much more bigger advantage, additional advantage.
No, in this case, she's asking drinking from a copper vessel.
It doesn't prevent.
Increase the impact the balance of copper in the body, and then it leads to cancer.
No, as such, copper. So we don't know. Actually, it depends upon how they made those bottles or this thing, whether it is dissolving or they have those coats which actually prevent copper dissolving into the water or not. But it definitely, and how much you have consumed, how long you have consumed, all these matter. Anything more will cause a lot of problems. So as such, there is no specific causality to say that if the copper levels in the body increase to a certain level, there is increased risk of cancer. No.
Okay. Praveen is asking, have you worked in Soumya Hospital?
Yeah.
Okay. Okay. How effective keto diet is for cancer of brain? I think you mentioned that diet has nothing to do. Right. Okay. Muhammad Arif says it's a good session and thank you for the details thing. If family history is for cancer type A, then subsequent generation have higher possibility for the same type of cancer or for all type of cancer.
So like I said, it's what is the type, that A cancer. If it's breast and ovary, one has to do a genetic testing in that patient, and if it is positive, they are at a higher risk. Otherwise, it's a sporadic event. That's it. So if we have now, we have the the capability to do all those tests to actually look whether there is a hereditary component. So especially stomach, pancreas, colon, breast, ovary, prostate, all these cancers we do hereditary testing for those genes. And if the patient is affected with that particular cancer, has that gene, siblings, kids, they need to be checked for those genes, and we need to put them on a screening program where we detect the tumors early.
Okay. Sujita is asking, can lichen planus? I'm not sure if I'm correct.
Lichen planus can cause cancer. No, it doesn't
Yes.
cause. It doesn't cause.
Okay. Can you elaborate on how nicotine patch work for de-addiction? Do you want to take this up?
So basically, when you smoke a cigarette, and the nicotine and its substrates, they go through your lungs into the bloodstream, and they cause whatever effect they cause on your mind. So it's basically you smoke a cigarette for its effect on its mind rather than the cough it produces. So nicotine patch causes that only. It again, through the patch, the nicotine enters the blood, and it causes the same the effect on the mind. What you are avoiding or bypassing is the harmful smoke, which you get with smoking or tobacco, which irritates the entire oral cavity, lungs, and all those things, and induce those lining, the cells lining these layers uh, from progressing to cancer. That's what you're doing.
Okay. Do all cancer need surgery, or can it be treated without surgery as well?
So basically, lymphomas, blood cancers, they all get cured by just medicines. They don't need a surgery. Some cancers, otherwise solid tumors, like if they are arising from any lung, liver, breast, all of them don't require surgery.
Okay. What kind of medication is given as part of maintenance therapy after chemotherapy?
So not all tumors require maintenance therapy. Like I said, in ovarian and breast cancers, if someone who is BRCA1 and 2 positive, we have newer drugs like PARP inhibitors, which we give them as maintenance therapy for a year or two. So that's the importance of checking for these genes. Not all tumors require maintenance. Only few certain specific tumors require it.
Okay. Shivanshu is asking, smoking 3 cigarettes a month is harmful as well.
Sorry?
Is smoking 3 cigarettes a month, is it harmful?
Yes, smoking any cigarette is harmful. It's better to get rid of any smoke.
Okay. How is cancer treatment in India as compared to foreign countries, as most of celebrities prefer to take it from foreign rather than in India?
It's just like, every phone is a good phone, but you still want an iPhone. You hardly use social media and phone. So it's just like that. So you have all the treatments here. For any drug which you don't have, you have agencies which can import the drug. What happens is, more importantly, you have to see whether we are following the science or not. That is the important, rather than looking at which country has the best treatment. I think we in India, we can have all kinds of treatment. Our biggest roadblock is the financial resources. Patients often don't have that amount of financial resources. A lot of our patients are uninsured. That's unfortunate. That's why our outcomes are bad. Patients most of the times end up late, even the educated ones. So that's the big problem.
Okay. Praveen is giving a good testimonial about you. So I'll just read it out. It's so good to see in the chat box such a good testimonial about you, sir. So you treated my father for lung cancer and you confirmed he was in the advanced stage. Unfortunately, my father did not survive. I thought you treated well, so referred to my friend for his mother. You said it's advanced stage and had to survive. My friend did not do the mistake. I did. He went to Baswar Taraka for second opinion and she survived and now she's healthy. Good to see some testimonials during the session. And okay, so I'll take last 2 questions. So since we're all working in the corporate with a desk job, what sort of cancer are most likely to get? Is it CNS lymphoma? For the corporate crowd, I know most of the people here are working in a desk job and working.
So CNS lymphoma is nothing but a cancer of the brain. So any tumor which affects the brain can cause, the symptoms which any brain tumor causes, headache, or depending upon the site of brain it affects, it can cause any other problem, like fits. It can cause weakness of the limbs, or it can cause any vision abnormalities.
Okay. I'll take the last question as well. So can lichen planus cause cancer? Please suggest something, because I'm facing this problem on my legs.
No, it really doesn't. But I think it generally doesn't predispose to cancer. It's not like someone with lichen planus has higher risk. One should, but it's more of an autoimmune disease, so one should get treated for it.
Okay. I think we are towards the end of our session and it's been amazing. We had a lot of questions answered. I guess we almost answered like 30-40 questions here in the chat. And thank you so much, Sainath sir, for having the session with us and giving us the valuable insights on the cancer and how to prevent and the awareness regarding this. I would like to thank the 4B's Care as well for doing the session for us on this Cancer Awareness Month. And thank you everyone for joining. I hope the session was very insightful to everyone. Thank you, doctor. Thank you again. Have a great day, everyone.
Yeah, thank you.
Bye.